Good morning, everyone. Welcome to the September 10th Paramedic Services Committee. We got a full agenda in front of us today, so that's why I want to get started right on the nose. First item is attendance. We do not have regrets from anybody, correct, Madam Clerk? But we do have quorum, and we're missing a couple members, so hopefully they can join us as soon as they can. Like to see a full attendance when we're dealing with the budget. That'll take us to item number 2, approval of the agenda. Can I get a motion to get that on the floor? And I'm looking to Mayor Bailey and Councillor Pierce. Is that anybody have anything they wish to add to the agenda for today under other business? Okay, I have none as well, so seeing none, call the motion. All in favor of the agenda? Declaration of pecuniary interest, again, do it at the appropriate time. No delegations today. We're going to go to item 5, adoption of the minutes from the previous meeting. That was back in July 16th. Can I get a mover to get that on the floor? Moved by Councillor Pierce, second by Mayor Davis. Anybody see any errors or omissions in those minutes? None from staff. I see none. Okay, all in favor of approving the minutes from July 16th? That's carried. Does anybody on the committee have any business arising from those minutes? Okay, see none. We'll go on to the first of several staff reports, noting that we do have 6 today. The first one is the statistical package, and this is just for information. So I'm going to ask if we can maybe get this one on the floor before we start. Okay, Mayor Davis, and okay, good, and Mayor Bailey. And we will note that Councillor Hunt has joined us via Zoom, so thank you, Councillor Hunt. Can you hear us okay?
I can hear you. Sorry, I'm on my phone. I couldn't seem to get logged in on my computer, so.
Okay, but you can hear us fine, Councillor Hunt?
Yeah, I can hear you fine.
Okay, good, thank you. Okay. Russ, is there anything in the statistical package you want to highlight for the committee today?
Through you, Mr. Chair. There's a lot of things I'd like to highlight, but I just like to, because this may be my last meeting here. So I just basically like to start by thanking everybody for the opportunity to be the chief for the last 8 years and working for the county and the city for the last 25. We've faced many significant challenges, including COVID, staffing, excessive offload delays. But moving forward, for the new chief coming in and dealing with the statistical package, we have a brand new station that phase 1 has been completed, and our new station opens and completed by hopefully August 2025. It'll be one of the best and most professional state-of-the-art buildings in the province. We've increased our ambulance fleet and are in a better place right now. Ambulances have been ordered to avoid increase in maintenance costs and breakdowns. We've increased our staffing. At the height of all of our calls and offload delays, our UHU that we were dealing with was 0.56. An acceptable number is anything less than 0.40. As of today, we stand at 0.37. Our offload delays have gone from 1 hour and 35 minutes on average to 39 minutes. The figures have not been this low since 2018, excluding COVID. We've also confirmed funding for our offload nurse for another year of $628,000. Meal claims have gone from $9,000 a month down to $2,300 a month. And with the launch of the MPDS on November 5th, 2025, we anticipate this cost to even go lower, as it is built in for some calls to be held for a longer period of time, allowing more flexibility for the crews to get their downtime and their lunches. Our code zeros have gone from 226 per month down to 90, currently right now as of today. And we're currently in the process of developing a solution through our communications department and our PRU report that has gone to council today regarding an improvement of our benchmarks for cardiac arrest and overall community awareness. These are some of the things over the last couple of years through this committee and other committees is a suggestion for the improvement of both the city and the county residents of Brantford and Brantford. So those are my statistical things I'd like to point out through the report as of today.
Okay, thank you, Russ. And yeah, I will note that sometimes we get these reports and the direction seems to be in the wrong way, but today that is not the case, so happy to see that. All right, do we have any questions for the chief on the statistical package? And we will go to Mayor Davis first.
Thank you, Chair Miller. First of all, I want to thank Chief King for your record of service to both communities. I think I agree you have much to be proud of in terms of how you've brought this, the service along in terms of efficiencies and dealing with all those issues we've had with COVID. You know, buildings are a fine legacy, and you certainly have a great building legacy that you're leaving behind. Couple of specific questions on the issue with respect to the sudden cardiac arrest, and it's really great to see we've come up from 31 now to percent in 2022 to 48%. I'm just wondering, how much of a factor is the distance issue in the county, right? Sometimes where the person is that has a heart attack can be quite a long ways away from the nearest ambulance station or paramedic station. How does it compare between the city and the county for response times on sudden cardiac arrest?
Through you, Mr. Chair, the basically benchmark, and I'm only going to use averaging right now, in the city, the response times in a more of an urban setting is supposed to be between 8 and 9 minutes. In a rural setting is supposed to be between 14 and 15 minutes. With the way we have our current deployment right now, there is a delay in the county. However, our recommendation for the PRU recommendation for 2026 will help with those response times and have more flexibility within the county and city at the same time.
Right, but overall we're 48%. What would that be just in the city?
Through you, Mr. Chair, I have not broken it down through the city. I think talking with other communities, we need to, as a city and a county, have more awareness of having AEDs, because that 6 minutes that we're referring to in the benchmark stops that if yourself, a community member, a firefighter, an off-duty, any person puts the AED on the person, that stops that clock, that improves. So we only can do so much with our resources we have. The community needs to do the buy-in and basically the awareness, and even more having them outside. Like I just came back from Europe, and almost every 2 blocks you had an AED posted on the exterior of a building. In some parts in Europe, they have a lock and key and you have to call for a code, but a lot of them have gone external so that you can use them at the back of the council chambers or downtown, rather than relying on like a florist shop or a pharmacy to go in between the hours of 9 and 5. So just a different approach on how to improve our cardiac arrest here. Canada's about, I would say, a couple years behind what they've done in Europe, but it's moving in the right direction.
Okay. In regards to the hospital offload times, a great improvement there, and you're hopeful the funding will continue from the province, and when will we know that?
Sorry, through you, Mr. Chair, I just didn't hear the last part of your question.
Yeah, because it's conditional. The reason why we're doing well with the offload times of the hospital, in part, is because the province is help to pay for 2 nurses, dedicated nurses, right? When do you expect to receive confirmation from the province that funding will continue, hopefully?
Through you, Mr. Chair, the funding is on a year-by-year basis. Currently, right now, just to give you an update of working with the offloads at the hospital, the ministry is still conducting quarterly meetings with our improvement and measuring their goals. We have funding confirmed until March 31st, 2026, and then the reapplication of the DONP or the dedicated offload nurse funding goes. I think we just received our funding letter approximately about a month ago, but that's to cover us this year, and that's the $628,000.
Right. So we're currently at about 39 minutes.
Currently, correct.
Can we do better than that?
Through you, Mr. Chair, we are doing better. If you're only measuring the 39 minutes, we're also measuring, if you look at that, we lost 450 hours in the ER, we'll say last month. Those 450 hours sound large, but if you're doing 95 calls a day with the amount of vehicles over 30 days, all we're losing currently right now is 15 minutes per call on average for a month. So yes, that can be improved, but I think what we really need is a larger hospital because things get backed up in the flu and cold season. It can be improved, but it's going to take additional resources and space at the hospital.
Okay. My last question for you has to do with there's a figure in here of 4,416, and that's the average number of calls, I think, per year, per ambulance. I saw that in here somewhere. Where
It's
is that?
35,000 calls per year that we have calls for service.
Yeah, hang on, we'll find it. It's in here somewhere. Yeah, I read it. So what's that based on? Bottom of page 6.
I know exactly what you're, okay. So that 4,416 calls annually is based on the time on task per call that we currently do with the number of resources. So that number keeps fluctuating. At the height of our offload delays, and we were losing 2 hours, say, per call on offload, we were only had the capability of 3,700 calls per vehicle per year. Now we're down to 39 minutes. With the decrease in the offload delays, has greater capacity to do more calls where available. If you flip over to the next page, in 23 and 24, we were at 107 and 106% capacity with the offloads. We were paying extensive dollars for code zeros. Our code zero chart has gone down, and now we're about 89% of our full capacity, allows us to do more calls.
Okay. So where does that number come from? 4,416.
It's based on 24 hours a day, what our staffing level is a day, the time it takes us, the time on task per each call. It's a formula that's all built in together, taking every consideration. So for an example, and I'm just going to use a rough number, if I have to do 34,000 calls, and it took, say, 2 hours per call, then you divide that 2 hours per call and divide it out by the number of ambulances, which shows your capacity. I don't have the formula right in front of me, but it is a formula to determine how many calls each vehicle can do per 24 hours.
Does the Ministry of Health have any standards for this? What the average
We
number of
measure
calls?
our own time on task here. There is no standard.
Is there like a standard for the profession generally?
Through you, Mr. Chair, there is no standard. It's what your resources allow. You could go to another service right now that only had 6 ambulances and had 34,000 calls. Their overall capacity would be a lot less than 4,100. They could be at 2,800 calls per 365 days a year.
So last question, are there comparative statistics between various paramedic organizations in the province?
How we measure our overall statistics and stuff like this is more, we've never introduced with council here the UHUs. UHUs is the vehicle utilization hours. As I said, an acceptable is 0.40. We were at 0.56. We're now down to 0.37. That's how we would measure against other services.
Okay, thank you.
Okay, we'll go to,
Sorry that sounded, but there's different measures.
we'll go to Councillor Pierce next.
Thank you, Mr. Chair. Through you, I've got my usual questions here, but now that Russ has said that this potentially could be his last, I might just make some questions up, so you never know.
I look forward to them.
So first of all, page 3, when you talk about the MPDS coming online November the 5th, that's fantastic news. I know you've discussed it. That's really going to help us. Is there anything else that I say we have to do for that transition, or we're ready to go? November 5th comes in, we're gone.
Through you, Mr. Chair, Rob Beatty, one of our commanders, and our Deputy Chief Neil Vanderpost has been working with other members throughout the province that have already launched MPDS. We're ready to go. We're ready to launch, right? There's a few things that we've just had to upgrade our phones and our information, so our technology is there. The education for our staff for the MPDS launch will be happening at our service CME in October. The next step is we have to meet with the fire department, because out of the current system, there was maybe about 500 different variations of call types. Now there's 2,200. They've taken every call, you look at the type of call, what kind of response do you need? You need 1 vehicle, do you need 2 vehicles, do you need fire, do you not, right? And they took it out to like about 22 different variations. The city fire has reached out to us as of yesterday, and they want to know how their overall deployment will change. Currently, right now, we just took our original tiered response agreement and added it, As we all grow into the MPDS system, we have the flexibility to make changes for the response of allied agencies to help us.
Perfect. Okay, and a little bit more on that. Further down in that paragraph, you state, how it helps ensure, each patient receives the right care and so on and so forth. And then you state, it's a global state-of-the-art professional standard for emergency medical triage via 911. When you say, so this is around the world, this system is being used?
This system is used widely in more of North American responses. Our old DPS and the DPS-2 systems were developed in the 1980s and 1990s, right? This brings us up to about the year 2020 of the current state. There's other models out there, but this is the state-of-the-art one that the province has chosen to go with.
Perfect, okay. So we'll go down to page 4 when it talks about the monthly call volumes. Last 3 months, trending down compared to previous years, compared to last year. Any reason why, or is it just people are healthier?
Through you, Mr. Chair, it could be people finding local doctors, using urgent care with some of the models and some of the advertising out there, just don't call 911 first. There could be multiple situations, or not, I wouldn't say people are healthier, but they may be finding other alternates of care rather than calling 911.
Okay, so I was hoping you'd kind of swerve into paramedicine there. You think that's affecting this as well?
Yes.
Perfect, that's what I want to hear. Excellent.
Can I just add one more thing? As we develop more into the different models of care out there, Niagara Region, which was one of the first adopters of the MPDS system, they have response units that can go to a call. You're not needed to go to the hospital, right? They can refer them out. Eventually, the different models of care will come that way. We're just not there yet. Okay. We don't have enough urgent cares and a few other things in our community as larger centers like Toronto or Niagara have.
Excellent, okay. And then page 5, you alluded to the fact that our offload time's down to 39 minutes. That, like you say, that's the lowest in several years, so that's great news. So on the next page there, so on page 6, when it speaks of, we're waiting for, confirmation that for the additional funding for the offload nurse and stuff like that. With all the work that's been done, and I'm trying to get a comparison here or something, if there is, if there's not, that's fine too. But with all the work that's being done on that has been done on the emergency department in Brantford, is that allowing quicker in it? Do you think that has any factor on our teams getting in and out of there quicker, or is it just more or less they've kind of expanded things to allow more people in?
Through you, Mr. Chair, it's not because of what they have done.
Okay.
Currently, we're in a major state of reconstruction right now, so they have 2 different triage areas. I think it's with the leadership and the cooperation between the paramedic services, the new ER director that we deal with and call on a daily basis, the new chair of the hospital and the CEO. It's completely a different culture change. It's just like you're doing the same thing, hoping for a different result. When they brought in Andrea Innes from York, one of the hospitals down there, how they changed theirs and had that meeting and had the ministry in there and have changed the culture and people working more cooperatively, coming up with new solutions. As I said, rather than doing the same thing over and over again, that's contributed to the changes in our offload times.
Okay. Good to know, good to know. Just a couple more, Mr. Chair, if you bear with me here. And I was going to say, Mayor Davis kind of hit it with the sudden cardiac arrest there. We're up to 48%, which is great, but we're still not hitting that benchmark. And then you just stated the times there, if I heard it correctly, 8 to 9 minutes for an urban and 14 to 15 minutes in rural for response.
Great.
Kudos to whomever is making that 6 minutes 48% of the time, because from what I'm seeing here with the distance that has to be traveled and the time, we can never make that mark. So, it's interesting when you say, if somebody, whoever on site, applies a machine or whatever, then the clock stops on that. But I'm curious as to, further on in the report, we're putting that up to 8 minutes, which is great. That at least gives us a chance. But I never realized the time it took within the city or within the county to get to somebody. We can never really make that 6 minute if it's relying on the paramedics to get there and help, right?
Through Mr. Chair, it's a community involvement. Everybody has to take their part. They've done that in Europe, because if you go to Europe, right, their distance for travel for the ambulance services are probably greater than ours are currently. If you look at an average call, and I'll say it this way, if something happened here right now, by the time you call 911, by the time the 911 dispatcher takes the call, and then they dispatch the call, and then the amount of crews, fire, police, or whatever have to get out of the call, right? You're averaging 2 minutes is already gone by the time the wheels are rolling. So you're really getting to somebody on that. That's why the cardiac arrest, that's why there's so much of a push. There's right now, they've launched the AED Foundation and Bill 141 to get more awareness of putting the locations of the AEDs in the central dispatch. So if I called right now and I'm just a bypasser and I said somebody's in cardiac arrest, they says, okay, the closest AED is in Parish Council Chambers, right? If it's open, go get it, or somebody, they're trying to connect all the dots so that the community gets as involved as much as you're relying on ourselves or fire or police.
Perfect. Yeah, I think you showed us a little snippet of that, so that's interesting. Final one, Mr. Chair. In your summary, you put, while the service continues to perform efficiently as possible, systematic challenges continue to place limitations on its ability to effectively respond to call demand. Can you elaborate a little bit on that part of it? And further down, it states, mitigate issues within municipal authorities such as resource availability. Is that resource availability as in paramedics, resource availability as in hospital, or a combination, or what are resource availability?
Through you, it's a combination of everything you mentioned. It's our resources, because for an example, during the day, we say we have 10 ambulances on and during the day and say 8 at night, but it's not just our resources, it's the resources of the hospital. If we're at the hospital and their resources are lacking, right? Bunch of nurses called in sick or injured, or they're not staffing, that's a resource. If they don't have beds, that's a resource. If they don't let us out, that's a resource. It's everybody needs to work together to make this an improvement, but those are lacking of the resources that we have. We do need, and both mayors have said, we need a new hospital, right? One of the biggest resources is real estate. If you want to expand your beds, like from what I understand is the construction at the ER right now, when they are done, it's not adding any more beds. It's just opening up different real estate. We need more beds.
Right.
We need more funding from the province for nurses. It's resources everywhere. You cannot solely rely on the paramedic services. I think that's what got us into trouble with the offload delays. I'm not saying this, the hospital relied on, but we work together. If their resources are strained, then they look to us to help out with their strained resources, but the culture has now changed, right? We work together, they get us off our bed, we get back into the system, and they have extra additional resources like the offload nurse.
Perfect. Thank you, Mr. Chair. Appreciate that. Thank you, Russ.
Yeah, thank you, Councilor Pierce. Yeah, no, it's all connected. Any other questions? Okay, seeing none. Most of my questions have been asked, so I've got two. So to you, Chief, on page 5 of your report, you talk about the time on task minutes, the hospital offload times. We haven't been down to 39 minutes since 2021.
2021.
Now,
2018, but 2021 was the start of COVID,
yeah. Oh, that's right. It was a special year.
a special year.
If I look at 2024, the offload time was 52 minutes. That's dropped almost 13 minutes now. Time on task has dropped 7 minutes. When looking at it, I thought, well, the time on task would have dropped 13 minutes, but the same as the offload times, but it only dropped 7 minutes. How come the time on task wouldn't have dropped as much as the hospital offload?
Right now, what we're doing is the time on task that you're looking at 2025 is just an average, right? For right now, the average is 39, but the time on task is 117. It could be additional medical procedures that has to happen to the patient, but we're just, the offload times are what our concern. Our time on task is at scene with the crews. The hospital offload times are what we're counting only in the emerge department when we get into there.
Okay, yeah, but you see what I'm saying? Okay, so you're saying there's other factors involved with that, and I got that, so, okay. And then the second question, last question I would have for today, and we're talking about response times, a little different, rural versus urban. Rural, you have the distances to cover. I don't think we're gonna get around that for the foreseeable future. If I look at an urban, is traffic becoming an issue? 403 was shut down the last 2 Saturdays. We had the Paris Fair. I know the traffic was jammed up. Obviously, a growing population, more and more traffic. So is traffic becoming an issue at all, or the driver's pretty good with the lights going and all that stuff?
Through you, Mr. Chair, there's always challenges, right? It could be weather, it could be traffic, it could be unknown scenarios, road closures because of runs and stuff. But our paramedics are notified of any changes and find an alternate route to go to that destination. If the 403 is closed and stuff like this, they're offered an alternate route.
So you're saying it's not an issue at this point,
There's not an issue at this time.
okay.
Through you, Mr. Chair, Brantford is a unique, basically 923 kilometers, like condensed little area, where if you go like to Hamilton or you go to London, right, they've got a lot of larger rural communities to go to. We're in a very unique situation that basically benefits us a lot in our response times.
Thank you. See no further questions. We have it on the floor, so I'll call the motion to receive for information. Okay. Thank you, Russ. Good to go out on a positive note. Let's go to item 7.2, and this is the 2026 response time targets and a performance plan. So let's get this on the floor. It's a recommendation, but let's get it on the floor, and then we'll talk about it. So moved by Mayor Bailey, second by Mayor Davis. Russ, did you want to speak to this recommendation about how we're going to improve our performance? Highlight what you see as we should be aware of.
Sorry, the report that you're referring to, sorry.
It's response time targets and performance plan.
Okay, so that's the PRU one.
It's the PRU.
Yeah, the PRU plan. So in another report, it marks that now that we've had an opportunity to make improvements on our response times, get our offloads down to 39 minutes, our time on task down, our PRU response time improvement is what we've noticed, and other communities like London have done this as well, is they've taken a transport vehicle and made a PRU, which is basically an ERU, or PRU is an emergency response vehicle. In other communities, they've put the advanced care paramedics on it to basically allow them to get to a call quicker and more of the higher acuity calls. For an example, our current model is if you're working with an ACP, next call that comes into your part of the city or your part of the county could be somebody with an upset stomach. So you're traveling at that point in time, the patient gets no matter the same care or a higher level of care between the ACP and PCP. What we're trying to do is have these ACPs available for a higher acuity call where their skills could be used in a more proficient manner rather than being on an offload or at the hospital for anywhere from 39 minutes to 2 hours on average in a day, right? We want to have the ACPs, your advanced care, more flexible to do the higher acuity calls to improve our performance.
Okay. I'll go ask the committee. We're going to leave it at that then?
We targeted the response times with the PRUs, A, to help out with the cardiac arrest, to B, higher acuity calls, and C, have greater flexibility for advanced cares to attend other calls when they may not be needed after the assessment had been taken place from the primary care paramedics on scene.
and we have to submit this, obviously, if we approve it to the Ministry of Health and Long-Term Care. I'll ask the committee members, are there any questions for us on the plan? Go ahead, Councillor Pierce.
Thanks, Mr. Chair, through you. I'll start by saying I think it's a great idea. Anything we can do to assist in getting somebody on site, and to have the ACPs, Advanced Care Paramedic, available for other things. The only thing that I don't like in the report is the fact of where you say will replace one transporting ambulance. So the driver of the said PRU, is that a different person than would have been driving the ambulance, the transport ambulance? Because I'm trying to, when I read this, I'm thinking that these are, if you want to call it, net new people in these additional vehicles that are going to be going to these calls. Am I correct in that, or am I wrong in that?
Clarification, what do you mean by net new people?
So a call comes in, and instead of giving it to ACPs, the ACPs that are going to get in an ambulance and go to that call, it now might go to, my apologies, I can't recall what you called the other ones.
Yep.
They're going to get in a different vehicle and now go to that call, right?
Okay, for clarification, currently, right now, when we staff a transport ambulance,
Right.
the configuration is an ACP and a PC partner.
Okay,
Okay, or it could be two PCPs, right? Just be kind of our ACP staffing level.
okay,
Our ACP levels have dwindled over the years from the original recommendation that has given to us by council back in 2005 and 2008 to have 67% ACPs on the trucks. So we're trying to utilize our ACPs for higher acuity calls. So what happens is, instead of having an ambulance staffed with two people,
right,
we'll say on a 12-hour shift, right? What we've done is taken the ACP off and their partner and put them on a PRU, or a response vehicle. We just have one less transport vehicle. So currently, right now, because the funding that you guys, that council approved as of last year for July 1st, we've been putting it off, as you've read in other reports, for our staffing till October 1st. We've been able to manage and decrease our current transports of patients. This new model that we're trying is going to put the ACPs just on, we'll say, a Ford Explorer with lights and sirens to attend and choose which calls they can go and offer a better assistance. So it's not costing us anything more that's already approved in the budget. It's just a different model of care that we are going to trial.
right, and clarification, if I could, Mr. Chair, and I appreciate the fact of it's not going to cost anywhere. I'm not worried about that right now. What I'm trying to understand is, so if you've got an ambulance that has two staff in it, okay? So instead of that one ambulance with two staff, those same two staff are now just going to be in a different vehicle that cannot transport somebody to the hospital.
Correct.
Okay, that's exactly where I'm going here, because if we think of our offload times and stuff like that, where we have transport vehicles that are at the hospital waiting to be cleared, and now we're taking one out of that pool, is that not going to affect potentially transport vehicles being available?
Through you, Mr. Chair, right now, we have 8.5 24-hour transport vehicles, or 10 during the day and 8 at night.
Right.
What we're doing with this PRU is, while those vehicles are, we'll say, on offload, or we'll say stuck there, this PRU can respond to calls, start treatment until another vehicle is released, or another vehicle from another surrounding community, if we need to, will be brought in to transport and treat that patient as well. So if you look at it, and I don't like the phrase, we're stopping the clock with somebody that is more flexible within the community. Currently, right now, we are running with 8.5 transport vehicle 24 hours and we're down to 89% for our coverage. So using this PRU as a trial for a year, I do not think it will affect our overall transports and made even better the overall higher level of care that's required on some acute calls.
Okay, I'll leave it at that then. And just one additional thing, do you think once the MPDS comes in, that that's going to be able to utilize those two vehicles even more because they can go to the higher acuity calls? Is that what you call them?
Correct.
As opposed to the other?
I believe the way it's designed with MPDS, there will be that much of an improvement.
All right, thank you.
I'm just going to jump in here. Getting back to Councilor Pierce's first question, I think, correct me if I'm wrong, Chief, this isn't replacing an ambulance. This is in addition to our 8.5 ambulances, yes?
So currently, right now, before your approval to up staff as of July 1st, 2025, we have 8.5 ambulances. The original approval that we had for an additional half or 12-hour staffing has not been launched yet. They'll be on the road by, I believe, October 1st. When we do our schedule picks for January 1st, 2026, that additional 12 hours that you provided to us will be the PRU. So we're currently operating at 89% capacity right now with 8.5 transports. And then when we go afterwards, when we get the PRU, we'll still have 8.5 transports, but the one PRU.
Okay, fair enough.
If you need further clarification, any other questions?
Look to the,
My apologies, Mr. Chair. I'm sorry, Russ, I'm still, that kind of confused me more because from what you just said, we've got 8.5 right now. So the additional 12-hour, which would bring us to 9, is not going to be used for a transport vehicle. It's going to be used for a PRU vehicle.
Correct.
Okay. And that's still going to leave us at 89% though.
Correct. Because of the improvements that we've made dealing with the offloads.
Okay.
We've improved everything like by an hour. That's got us down to having more, rather than being at over 100% capacity, relying on other EMS services to provide us our calls. It has basically, with the improvements from the offloads and everything else it has given to us, has brought us down to below 100% to allow us the ability to do this as a 1 year. At any given time, as I've said to our crews, if this does not work, it is a simple fix. From going to 4 people, that's 12 hours staffing, you add 2 people each on an ambulance, and we get a transport vehicle back within a millisecond. That's how quickly it can change if this trial that we're going to do to improve does not work.
Okay, thanks. I like the fact of it staying at 89% without that extra half ambulance. That's where I'm kind of getting confused.
We've
there, but-
included the 9 into it, but yes, it is included. If you
Okay.
look at the figures, it is the total 9 of our forecast.
I'll leave it with you. Thank you.
okay, that actually does help, well, helps me anyways. And what it looks like is it's giving us more flexibility.
Correct.
Yeah, okay, fair enough. Any other questions for the chief? Okay, see none, I just have the one question. So we're looking for 2 paramedic response units. Is that one of our options for the budget for today? Is that dependent upon us approving that?
Through you, Mr. Chair, yes and no. If we know, to be clear and transparent, we do have a PRU available to run this PRU trial in 2026 without purchasing another ambulance or ERV. It would be utilized that we'll be using our existing resources or a spare ambulance if for any reason the Ford Explorer is in the garage. However, the other portion is an advantage to us that you have in the package here about buying the 2 ERVs from the CP program, because they don't need that much bells and whistles on them, just that when the CP program allowed them to purchase, that was the only thing that was available. So transferring those 2 vehicles that are 5 years old improves our fleet, and then CP can purchase, we'll say, 2 RAV4s or something smaller, and using the resources accordingly.
Okay.
Like, you don't need a whole ambulance to do the CP program, right? But if we move their resources over to us, it saves us in overall further, for a few years, capital purchases of brand-new ERVs that are probably about $130,000 each.
Okay, so I just wanted to be clear, that so this recommendation is not dependent upon approval of all the recommendations in the budget, that's what's at.
Correct, but it would give us better resources.
Yeah, okay. I don't see any further questions, so I'll call the question then, and we've moved it, yeah, second it. So, and this is, again, will be going to the Ministry of Health and Long-Term Care. So all in favor of this?
Mr. Chair, could you repeat what we're voting on, please?
We are still on 7-2.
Okay.
That's the performance plan.
Okay.
So I'm going to call the question. All in favor? Opposed, if any? Okay. Thank you. Okay, so this is going to take us to 7-3, the fleet program. Can I get a mover for this one? Okay, moved by Mayor Kevin Davis, second by Mayor Bailey. I think this is straightforward, but are there any questions or comments from the committee on this one? Go ahead, Councilor.
Sorry, Mr. Chair. Page 2 of the report, the very last thing, 10-month lead time in order for placement. Doesn't history tell us that that is not long enough?
Through you, Mr. Chair. We have been told 24 months to get a vehicle. We've been told 12 months. We've been told 9 months and stuff like this, right? It's a wave right now. All of a sudden, we were told that the vehicles that were coming online, we weren't supposed to get to early 2026. They arrived 2 weeks ago. So we're just estimating on what the worst case, the best case, and we came up with approximately 10 months.
Okay.
It could take longer. What we've found out, and as part of the budget process, is the manufacturer already have 1 or 2 vehicles in spare in case somebody gets them munched up. At the end of the year, if they have additional spares that they can push out to people, that's where we got lucked out, right? Because I believe they had extra ones that we already purchased that were ahead of the schedule, and that's how we got ours early. So we've got 2 brand-new ones that are currently at the garage being stickered up. And that helps us with our overall expenses, with our maintenance costs, because we have a newer and younger fleet. That Neil had put this, Deputy Chief Vanderpost had put this together, and it also was one of your previous questions on wanting to know our mileage, our current fleet replacements and stuff like this, and that was the chart that was provided and put together from finance.
I like that.
Okay, any other questions for the chief on the fleet management plan? Okay, seeing none, I'll call the question. All in favor? Okay, opposed, none? We're going to construction. We're going to the item 7-4, construction update. Update 5? Brantford Paramedic Service Headquarters. Can I get a mover to get this on the floor? This is just for information. Moved by Councillor Pierce, second by Councillor Bailey. Cindy, were you going to talk to this one, or are you getting ready for the next one?
I can answer questions if there are any.
Fair enough. Any questions for Cindy on the update? Okay, I'll just, Councillor Hunt, I don't, okay, go ahead, Councillor Pierce.
Might as well keep it rolling, Mr. Chair. Just as far as phase 2, like the garage, we're still on target to have it at least closed in by winter so they can work on it through winter?
Through the chair, yes, that's correct. The schedule is progressing well as per planned. I understand the structural steel has all arrived there. Russ he can look out his window now and see exactly where they're at. But
Walls.
things are going well as far as the schedule and overall.
Okay. I hate to say winter when it's only September and I'm wearing shorts, but we'll say it anyway, right?
Yeah. Any other questions on the update? Okay, good news on that. And it looks like Colliers is doing an excellent job of managing that, and sometimes I think there's other projects we should have brought him in on throughout the county, but I digress. So all in favor of receiving that for information? Okay, thank you. So this is going to bring us to item 7.5, and now this is the budget. What we're going to do for today is we're going to have Cindy go through the PowerPoint presentation that she's prepared. Then we're going to get it on the floor after that. We'll take questions, then we'll get it on the floor, and then we'll see where that leads to. But we'll start with your presentation, Cindy.
Good morning to committee. I will be presenting the 2026 budget this morning. I want to start off by thanking our staff from finance as well as our paramedic service leadership team for all their work in putting the draft budget together. And I'm sure that committee will have some questions following the presentation, and we're all here to help assist with that. So our Brantford Paramedic Service, just at a high-level overview, is the delivery agent of paramedic services for the County of Brant and City of Brantford, serving over 145,000 residents and visitors to our communities. The service currently has 7 locations throughout the city and the county, and the service provides pre-hospital advanced medical care, patient transport, and community paramedicine. The current organizational structure is on this slide. So we have our chief, we have 2 administrative assistants, there are 3 deputy chief positions, we have 10 full-time superintendents and 1 commander, as well as all of our primary care and advanced care paramedics. The service currently has a total of 108.5 full-time equivalents. The service operates under 3 divisions. We have operations and quality assurance, which has oversight for regulatory compliance, quality improvement, continuing education and training. We also have our operation and logistics section. This provides oversight of deployment and resource utilization and supports all sections in procurement and asset management, as well as our community paramedicine program, which has evolved and grown significantly over the last few years. It supports patients in the community at risk of declining health status, helping reduce emergency department visits, and bringing care into patients' home or community settings. And just to reiterate some of our performance statistics, this chart comes from our stats package, but we've also included a column to project for 2026. Our calls for service in Brantford have risen fairly dramatically over the last 10 years. The Ambulance Strategic Action Plan conducted in 2016 projected call volumes to increase an average of 6% year over year. Demands on call volume are greater than population growth overall. As the population is aging, there's an increasing propensity to call an ambulance, and gaps in primary health care widen. The call volume is estimated to increase by 6% in 2026. Historically, 75% of calls for service are in the city of Brantford and 25% of calls in the county of Brant. And this chart is something that committee discussed earlier on our response time standards performance. There is a gap in the sudden cardiac arrest, and hopefully with some of the strategic initiatives that the service is undertaking, we can work to lessen that gap moving forward. System improvements have been a priority for the paramedic service over the last year to find efficiencies and innovative methods of service delivery without compromising patient care. The dedicated offload nurse program received funding to support patient offloads at the hospital. And with enhanced staffing at the hospital, this funding was utilized over the last year with success. The Ministry of Health Special Advisory Group project that involved the Brantford General Hospital staff and our staff last fall developed strategies to improve offload delays. This project has been very successful and resulted in a culture shift, as Chief King spoke to earlier, at the hospital to prioritize patient offloads and improve communications between the hospital and paramedic staff to address concerns. All of these are successes that should be celebrated but received with some caution, as systemic pressures on the overall health system are expected to continue to rise, particularly with capacity pressures at the hospital and access to healthcare in the community. Our community paramedicine program has been a success and is designed to bridge the gap in health and social systems in the community. Our statistics are showing for those that are enrolled, there's a 40% decrease in calls and visits to the ER for clients comparing pre and post enrollment in the CP program. The CP funding from the province for the service for this year was $2.3 million, and this funds approximately 11 full-time equivalent community paramedics. Looking at the accomplishments for this year, we completed and transitioned to the new paramedic headquarters, Phase 1. Construction commenced for Phase 2 garage and is ongoing. As we've discussed, the project to reduce hospital offload delays has been successful. And finally, we have the impending launch of the MPDS system. The 2026 priorities include completion and transition to the new paramedic garage space, work on a new paramedic service master plan, implementation of the MPDS system, and a leadership transition and succession planning with Chief King leaving the service. So as far as the budget process, the shared services agreement with the county and the city outlines specific targets and dates. So by October 1st, Paramedic Services Committee is expected to recommend a draft budget and forward the draft budget with appropriate breakdowns in detail to the city and the county. So that is what we are here today to discuss. If that does get approved, there are other targets that we follow throughout the budget process outlined on the slide. Overall, the 2026 base operating budget, this is from the report. So this outlines the changes from 2025 to 2026. Our revenue increasing from the province overall, total expenses, the overall net levy increase is 16.6%. And the breakdown between the city of Brantford and the county of Brant, which is all under the shared services agreement calculation, is shown there. The city of Brantford's increase would be 16.5 and the county of Brant 17.1. The 2026 capital budget and forecast was included in the report as well. This includes capital asset replacement and investments that total just over $1.2 million in 2026. There is a relatively small increase in the transfer to reserve compared to previous years of $42,500. The assets specifically include replacement of 3 ambulances, replacement of 16 tough books, computer hardware replacement, and some requirements for the new headquarters, a floor scrubber, AV equipment, and security system. The 10-year forecast included in the package has an adjustment proposed each year over the next 10 years in transfer to reserves to stabilize investments required for asset replacement over time. So our budget drivers in 2026 are listed on this slide. Our wages and benefits are a significant driver in 2026 and are a significant portion overall of the budget itself. This includes salary and benefit adjustments for all full and part-time staff. It includes results of a non-union market compensation review that the county undertook, benefit premium increases, and cost of living adjustments budgeted for 2026. The annualization of the approved new resources in 2025 are also included. This was the 12-hour staffed ambulance or four full-time staff and half a superintendent position. The additional positions were budgeted to start July 1st and were fully funded in 2025 by the net levy. In 2026, the wages are budgeted for a full year, but will be partially offset by provincial funding. The 2026 budget includes an adjustment to transition one superintendent position to one commander position. The commander position is considered a critical need to support appropriate administrative oversight and organizational structure of the service, and will also assist to support staff development and succession planning. Our meals are anticipated to decrease in 2026 based on downward trends in meal claims year to date, and this is tied to the reduction in offload delays at the hospital. Clothing is increasing based on inflation pricing to uniform items and ongoing staff recruitment. Patient care has a budget increase to ensure proper funding of medical supplies and equipment, looking at inflationary increases to supplies as well as expected growth in call volume. An adjustment to fuel is included based on our actuals this year. We are looking at likely going over budget and fuel in 2025. We do have more vehicles on the road as the service grows, and fuel costs continue to rise as well. The next one is a big budget driver for 2026, which is our leases. So phase 1 and phase 2 of their planned lease costs with Grandbridge Energy are included and are projected to be within the original project budget estimates. 2026, well, I will describe it, will be the worst year for impact financially of the new lease on the budget. In subsequent years, we will see that provincial funding offset the leases. Our janitorial costs will increase to support the new paramedic headquarters. Legal services are budgeted to increase based on a review of our actuals over the past 3 years, as we have been going over budget in that line. Cross-border is expected to decrease in 2026. Most surrounding services have agreed not to charge for cross-border, and we are decreasing our reliance on outside services. The insurance premiums increase in 2026 under the county's insurance renewal. I've already touched on the transfer to reserve under the capital. And our provincial funding is increasing by just over $1 million based on funding of 50% of the 2025 budget. There is a decrease budgeted in administrative overhead expected from funding from the community paramedicine program. So this slide provides committee an overview of a base budget forecast, and this is the first year that the service has undertaken this exercise. As you can see, there's a big increase in 2026, and again, this is significantly related to the new lease, the garage space. The 2027 year reflects the offset of provincial funding, which continues on through 2028 and 2029. We have included some additional resources in the forecast. There is an additional 12-hour ambulance, so that would be 4 full-time staff, included in 2027, as well as 2 additional administrative positions to support administration and logistics in 27 and 28. So that is currently included in our forecast. The service has change requests, so these would be additional budget investments for 2026. These used to be referred to as decision packages, so just some new terminology this year. The first is for expansion of the First Watch software program. This software aims to enhance the service's data-driven capabilities. It builds on an existing integration that we have with community paramedicine. Some of the benefits include enhancing real-time situational awareness, improving operational efficiencies. It will improve quality assurance with oversight of patient care records and improve data-driven decision-making. This software is already in use by many other surrounding paramedic services. The second change is a request to purchase 2 ERV vehicles, and this would be from our community paramedicine program. These vehicles are equipped with features beyond the requirements for community paramedicine and could be fully utilized through our 911 response at a reduced cost. The vehicles have been in service with CP for 5 years as of March 2026. They would strengthen operational capacity, reduce the need for immediate capital purchases, and support long-term service sustainability. This slide is staff's recommendation for the 2026 budget. So this includes the base operating budget, which I've outlined, our capital budget, as well as the 2 new budget investments for committee's consideration. Thank you.
Okay, thank you, Cindy. What I'm gonna do is we're gonna get the whole thing on the floor. And then we're gonna go through questions, and then, we can do different things. We can, do amendments, we can break it down, and vote on each one individually. But for now, let's just get this recommendation on the floor, and then we'll discuss. So can I get a mover to get it on the floor, please? Okay, moved by Mayor Bailey, second by Councillor Pierce. Okay, the questions, Cindy, we'll direct them to you. If you need the chief or Heather to jump in, obviously you know how to direct it, so. Okay, and Mayor Davis, you had your hand up first, so we will go to you, and noting that there's no time limit. Sure. Gary?
Okay. First of all, comment, Chair, that the longer I sit as mayor, the more frustrated I become with the provincial government, you know, whether it's trying to take away speed control cameras or bike lanes. And I look at this budget, and the city will pay about 42%, and the province the same. And I really have trouble with the province, which has responsibility for the healthcare system, and this being an essential part of the healthcare system, isn't paying its fair share, which should be at least 50%. That's my little rant in that, but we all know that. So, but I have some questions. What is the percentage increase in the budget from 2020 to 2026? What's that dollar increase? Perhaps you can provide that to me in a few minutes? And then,
Yeah, let's go to the next question, but.
Yeah,
Okay.
through the
Heather.
chair, I think the treasurer has done some work on that, so I'll let her look that up, but we can move on.
so my next question, which I think will kind of telegraph an amendment I want to make, how much can we save if we well, first of all, this is based on 9 ambulances, 9 units, correct?
Through the chair,
It
that's
was
correct.
8.5, but it'll be 9 next year.
That's correct.
Right, okay. How much do we save if we take a back date?
Through you, Mr.
If
Chair,
we-
I did not hear you clearly.
How
Sorry.
much will we save if we build a budget based on 8 units?
That would take some time through you, Mr. Chair, to calculate that, because it's not just the wages, it's also the maintenance and the other things for the vehicles.
Can you ballpark it?
Best educated guess dealing with wages and vehicles, $1 million.
Yeah, okay. Those are all my questions.
Okay. Go ahead, Heather.
Through the chair, the increase from 2020, where the annual budget was 6.5 million, is 90%. So we have gone up significantly.
9%, okay. One thing I will say, to Mayor Davis's first comment, the provincial contribution 42%, completely agree with you. We did make a presentation delegation at AMO there a couple of years ago. I thought we had some success, but yeah, 42% is not 50%, so I agree with your frustration. Any other questions or comments? Go ahead, Councilor Pierce.
Thanks, Mr. Chair. Just back to Cindy's report there, clarification for the leases. And you said 2026 would be the worst on the leases. Is that because it includes not only our new facility, but still all the other ones, right?
Yeah, through the chair, that's right. So 2026 will have introduced for the first time Phase 1 for the full year,
Right?
right? So both municipalities have to pay 100% of that cost next
Yep.
year.
Yep.
And Phase 2 is budgeted to start August 1st, so from August to December. And the Phase 2 lease is significantly higher than the Phase 1. So both municipalities are paying 100% of that cost in 2026.
Right, no, I appreciate that, but
Yeah.
not only does this include Phase 1 and Phase 2, but it also includes the leases on all our current buildings to
Right.
get us to the point where we can move those units over, correct?
That's correct. Through the chair, we have extended the leases on the 2 Henry Street locations for 2026. They've been extended to the end of next year. This is to ensure that in case something does maybe go off the rails with construction that's unanticipated, we're not left with nowhere to go. Now, I believe both of those leases have, a certain period of an out clause type thing. So we might be able to get out of those sooner, but we can't anticipate exactly when that would be.
Okay, no, I just wanted to just confirm that it is what it is, because it's got everything in there for this one.
Yeah.
You're at 100% of our cost for Phase 1 and Phase 2. Thank you.
Okay, we'll go to Councilor Hunt next.
Thank you, and through you, Chair Miller. A couple of questions. First of all, I also want to echo frustration with the fact that the province is supposed to be funding 50% of the service and 42% is not 50%. And I'm wondering if other municipalities are, or if there is a way for us to do some kind of environmental scan to see if this is just a Brantford Brant issue, or if other municipalities are also only being funded of 42% of their base operating costs. So that's my first question. The other question I had under the change requests, the purchase of 2 emergency response vehicles at $85,500 seemed low to me. Does that, and I realize they're for the community paramedicine program, but is then there an additional cost to outfit them? Like, is this just the purchase of a base vehicle? And even then, I find it hard to have us purchasing 2 vehicles for $85,000. So if I could get some clarification on that particular figure.
Okay, we'll start with the first question, and the first question is, other municipalities, are they also being shortchanged their 50%? And the answer is,
Through the chair, my guess is yes. My understanding is that all paramedic services in the province receive 50% funding of the previous year's operating budget with no inflationary increase. So we would all be in the same boat that way. For us, because next year we have that lease cost on the books, we're seeing, that I think heavier hit on the municipal budget because the province does not recognize up-to-date years as far as that 50% goes. They're always a year behind.
Okay, so if we follow that up, so we've got, I'm sorry, I'm scrolling here. A 16.6% increase in 2026, but then we drop significantly in 2027. So will we catch up with the funding in 2027? Like, I realize what you're saying is we're taking a big hit in 2026. Sorry, I'm just trying to find out the. Oh, so yeah, so I guess I'm looking at page 7 of the report. So 2026 proposed budget is 16.6, but in 2027 it's 3.3. So am I going to assume then that our revenue based on the previous year is going to be significantly higher in 2027? Like the provincial revenue, sorry, because it's going to be based on supposedly 50% of the previous year.
Yeah, through the chair, yes, I think your understanding is correct, Councillor Hunt. 2027's budget will be based, as far as provincial revenue goes, based on 50% of the 2026 budget. And so in 2027, the province, as long as they keep their funding formula the same, will be funding 50% of all of those lease costs in 2027. And I would expect if we do the same analysis for 2027, that 42% will go upwards. As long as we don't have other unanticipated new significant investments in the service in 2027.
Okay, because I mean, 16.6 is a pretty tough pill to swallow, but then we look at 20, like for the next, like looking at a 4-year budget, we're at 3.3, 1.2, 1.5. So I'm looking at that. And then, yes, my second question is around that figure for the purchase of 2 vehicles of $85,500. That seems low to me for the purchase of 2 vehicles. So if you could explain that, and then I'm assuming the outfitting of those vehicles is a different budget line.
okay, and for that question, yeah, we'll go to the chief, because he's got some information you want to share.
Through you, Mr. Chair, these vehicles are fully loaded. There is no additional cost, no additional upkeep in those vehicles. They are a mirror copy of the current ERVs that we currently use on the road right now. So all we're doing is realizing the actual costs, or basically value, of these 2 additional vehicles, bringing them over from CP. As General Manager Cindy Stevenson said, that they don't need all the bells and whistles. So there's no additional work or anything that we have to do by transferring them over. And that's why we're getting them at the, as you said, 2 vehicles at an $85,000 cost. That's the value of those vehicles currently, I would say, on the books with CP.
Okay, all right, thank you for that.
Okay, any other questions from the committee or comments? Before we go, before we start introducing the amendments or whatnot. Okay, seeing none. I will make one comment. This is a very difficult budget. I think we all appreciate that. I will say to the chief and to General Manager Stevenson and to the treasurer, you laid it out well. Right? You laid it out well about why it's there. We see inflation. We see an increase in call volumes. We know there's a year delay from the province for leasing. We also know that we weren't keeping up with what we maybe should have for the lease spaces because we seen us bursting at the seams for that. So there's a lot there. Understanding it and communicating it to the residents who are paying the bill, maybe not so easy. So that's my only comment. But again, I just want to, again, thank you guys for laying it out very well. I thought you did it, you laid out very well for what is a very, very difficult number.
Mr. Chair, can I say something?
Yeah, go ahead, Chief.
It was referring back to what Mayor Davis said. He said, how much has our budget increased since, we'll say, the last 10 years? And it was 90%. But looking at, we were in a huge deficit for our call volume. Our call volume and everything else has increased over 70%. That 70% of the differential between our budget right now, we wouldn't be in the position that we're in right now.
Point of order.
Oh, sorry, I was just
Mr. Chair,
answering.
like we have staff that are arguing and trying to present, they're trying to take a position and present an argument before a motion's even been put on the floor. I think that's inappropriate.
Mr. Chair, I apologize, it wasn't started an argument. I was just trying to help with the figures when you asked about the 90% of our call volume and our increase. I do apologize.
Okay, yeah, and yeah, just the facts for.
Yep.
Councillor Hunt, you have your hand up. Is that from before or is that?
No, sorry, I did have another quick question.
Okay,
So
go ahead.
we're currently running at 8.5 ambulances. And we're going to 9.
Through you, Mr. Chair, that is correct.
Okay, thank you.
Okay. Okay, no other questions? Yep, question or, okay, no comments? Okay, go ahead.
Okay, so I'm looking, I hope someone will second this, just to get on the floor for discussion. The resolution is that staff be instructed to resubmit for the committee's consideration a revised budget based on 8 units for 2026. So looking for a seconder to get it on the floor for discussion.
Okay, hold on a second here. Can I just do one thing? And I want to go back to the report. When did we last have 8? I just got to ask this question. When did we last have 8? And if I go to Russ's one report, I can find that out.
2023 from the report.
Okay, so the resolution is asking that staff come back with 8
Yes,
active ambulances.
that they resubmit for our consideration, or submit for our consideration, a revised budget based on there being 8 units. So it's not saying approving 8 units at this stage, but asking to give us an alternate budget based on 8 units.
Okay,
So looking for a seconder.
so let's see, do we have a seconder for that? Okay, Councillor Pierce. Okay, it's on the floor. We can discuss. Mayor
I make my
Davis,
pitch?
can you, yeah, please go ahead.
Okay, thanks. Couple of statistics for that period that I was asking for, 2020 through to 2025, 2026. A couple of relevant factors. I mean, the population in this area over that period of time has increased around 14, 15%. It's slightly different between the county and the city. Inflation's been around 19 to 20%. If you look at the numbers on call volume, that's increased 40%. And then if you look at the breakdown on the call volumes, we know 15%, they should not be calling an ambulance. You should not be calling an ambulance if you're unwell or dizzy. You should be told, go to a walk-in clinic or talk to your family doctor. It's very, very expensive to be providing ambulance service for those types of requests. And we've known that now for 6, 7 years that I've been on this committee. We've asked staff, deal with this demand issue. Your solution you come to us with is keep piling on ambulances. rather than trying to really effectively deal with this demand that we know a large portion of the call requests really should not be going through the paramedics. I'm really very concerned about the economic situation. We know we've had a lot of recent inflation. We know wages haven't kept up. We know that last quarter in Canada and in Ontario, there was there was a contraction, an economic contraction. The province has lost province-wide the last month about 26,000 jobs. That's not going to get any better. People are hurting. They're going to be hurting, more of them. And we continue to put in place these property tax increases that are 3 or 4 or 5 times the rate of inflation, driven usually by, it's paramedics or police. And if you think about that figure, 90% over 5 or 6 years, it's unsustainable. I've said that every year. I think we've hit the point where it is simply unsustainable. A line has to be drawn for fiscal responsibility. We simply cannot continue to do 15, 16, 20% budget increases per year for paramedics. It's unsustainable. That's what it's been over the last 5 or 6 years. That's why it's 90%. Also, if I look at the stats, the average we're told is 4,416 capacity per vehicle. The anticipated call volume is around 35,000 and change. If you take that call volume anticipated, divided by 4416, you get 8. Yeah, it means that the service will be operating closer to full capacity, but yeah, at some point we got to be thinking about the taxpayer. And this budget item, last 6-7 years we've always accepted it just as requested. We've asked, come on, let's try and deal with the demand side, but we really have not. And I think we need to send a message to the service that we support the service, they do great work, but at the same time, at some point, you got to say enough's enough. And you got to live within a certain budgetary envelope. And I suspect even if you take one paramedic out, one ambulance out, there's still going to be a healthy increase, I suspect. That's why I want to see it. I want to see what the budget numbers are if we do this, because I think it would be irresponsible to do this without seeing actually what it looks like in the budget. So that's the pitch.
There was nothing in there I could disagree with. We do know it's tough for people out there. Does anybody else want to speak to the, go ahead, Councilor Pearson.
Yeah, so I guess a couple things. I understand where the mayor's coming from here, but a couple responses, rebuttals. I agree with the fact that a large portion, or a number, I won't say large portion, but there's definitely a number of people calling 911 for an ambulance that should not. 100%, I agree with that. The same as there is a lot of people going to urgent care, emergency rooms that are not an urgent necessity or an emergency. I don't think we're ever going to curb that. And you use the example of a cough, a sniffle, and stuff like that. I agree with the statement, but I don't know that we as municipalities, I'll even go as broad as that, are going to be able to stop that. Again, there was a report that came, and it was from the Willett Urgent Care. This is a few years back, and it was almost 65% of the people that were going to that urgent care were going there for things that were not classified as urgent care. So again, I agree with that, but I don't think that we as a municipalities are going to be able to curb that. Again, you're absolutely right, the things you were saying about being fiscally responsible. I get that and I appreciate that, but I have a tough time noting what I just said about people are still going to call 911 is balancing the fiscally responsible when it comes to healthcare. Because in my head, again, I'm not disagreeing with what you said, Mr. Mayor, but what I am saying is the fact that if this goes through and it comes back to us and hypothetically we vote on it and we pass that, and then we're in a situation where you've got that person that's got the sniffle still calling an ambulance, and we've got somebody that really needs an ambulance ASAP and that extra unit's not available. So I have a really tough time with balancing fiscal management. Don't get me wrong, I want to be fiscally responsible. That's not, I'm not denying that. But it becomes a tougher call, so to speak, when you're trying to balance that with healthcare, when you know that other side of it, which again, I agree with these people calling it that shouldn't be, are going to continue to call that. I think that's something, and you alluded to earlier with the province, even their 42%, I think that message or that change needs to start at that level. And I'm not even sure that the province can change that. You know, I guess we can be thankful in Canada that we have the healthcare that we do, and people are able to just call 911 or go to the urgent care, or go to emergency when they do have a sniffle, and they don't have to pay out the wazoo as they do south of the border. So I appreciate where you're coming from here, and I would, you know, sure, let's see what the difference is with the 8 ambulances, but it's a tough call, and it's going to be a very tough call to make. Thank you.
Okay, Councillor Hunt, you have your yellow hand raised. Did you want to speak to the motion?
Yeah, so, through you, my concern with dropping, from 8.5 to 8 is that all of those, great statistics that, we've seen an improvement in, we're gonna see a decline in, and that brings me some concern. While we're running numbers, is it possible for us also to have a look at what if it's the status quo? So it's the 8.5 that we currently have. So then we're not reducing service. So, if, I don't know if that's would be considered a friendly amendment, Mr. Mayor, for us to see 2 sets of numbers, 8 and 8.5.
Happy to do that.
Okay, that's a friendly amendment.
Okay. Just because that gives us a baseline in terms of if we're not increasing to 9 and we're going to keep the status quo at the 8.5 that we currently have, that would hopefully not impact what I consider to be a very positive statistics package that we just passed earlier in the meeting. And then my other concern, well, and I mean, this is the healthcare system in the province of Ontario is chronically underfunded, whether it's ambulance, hospital, you know, you name it. And the population is growing, but it's also aging. And as someone that spends enough time at the BGH and uses our paramedic services, can tell you that there may be people that are calling because they have a sniffle, but there's also a significant amount of people that are calling because they are, you know, they're having a heart attack. They're having a stroke. I spent some time last year on the stroke floor myself, and I can tell you, I was probably the youngest person on the stroke floor, but it's just the chronic underfunding of our healthcare system is just showing in this budget that we're considering as well. So I'd be pleased to see both sets of numbers. And hopefully, we can make a decision that is going to provide our community with the service that it needs. Thank you.
Okay, thank you, Councillor Hunt. I should have checked with the seconder if he was okay with that friendly amendment. Okay, looking at the numbers for an 8 and 8.5. Any other questions or comments, Mayor Bailey, on the motion on the floor then? Was the motion an amendment?
Through the chair. Through the chair, I mean, if we're just going to be bringing back 2 different sets of figures, but I'm having a hard time taking out an ambulance when Mayor Davis said, you know, things are bad out there right now and they're getting worse, and jobs are hard to find, and people are having heart attacks and they are having strokes. And it would be very hard for me to vote to take an ambulance off the fleet that we've been anticipating, the 8. And it's, it's the same kind of deal as at the hospital, revisiting a budget to get rid of 3 PSWs to save $750,000. I would never do that either. So if you want to just find the numbers and look at the numbers, but I certainly couldn't support a vote.
Okay, any other comments or questions? Go ahead.
Yes, so Mr. Chair, I'm not, I take issue with that some of my motion is suggesting that I somehow am so insensitive that if you have a heart attack, you don't get an ambulance. That's ridiculous. But we do know that 10 to 15% of the requests that come in are, the sort, I got a stomach ache, I got sniffles, I'm feeling a bit dizzy. Those services are available in our community. I know back in the spring, I had a bee sting and was starting to swell, and so I wanted an antihistamine. So there was a clinic in West Brant on a Sunday, and I got there and saw a doctor in an hour. That's what you do. And the system it's almost like concierge medical service on wheels. I mean, that's what it's become. And if someone calls in, they got a stomach ache, they should be told, go to a walk-in clinic or see your family doctor. Or an urgent care clinic, and we've got them here, you've got them here in Paris, and we have them in Brantford. They should not be using ambulances, and they should be told that. And if you can cut out 10% of the call, and we've been asking for this, which is controlling demand, not simply writing blank checks on the supply side. I think we need to send a strong message telling the service you need to do it. You got to get control of this problem. And that if we can save 10% of the calls, then there you go. There's maybe 9.5 units. So that's what I'm really focusing on, and that's what I'm concerned about.
Okay, thank you for the clarification. We're going to go back to Mayor Bailey.
Yeah, through the chair, my concerns are the mental health piece. A lot of people aren't nearly as stable as other people are. And anxiety and a heart attack seem very much the same when you're scared, when you're at home and you're alone and you're on a side road. And I think phoning in a paramedic would be the first thing that you would do. I'm sure there are people that call people for sniffles. I wouldn't, and maybe you wouldn't, but some people would, because there is a mental health component to the whole thing. These are tough times. They're getting tougher, as you said, Mayor Davis, and they're tougher. And people don't think rationally when they're scared, when they think they're having a heart attack. And it's just anxiety. It might just be a bad day. They've gone through the bills. They can't pay them. They think they're having a heart attack, and they call a paramedic. I think we're trying to group too many people into a small box, and I just think that people need to go through the hard times that they're going through now, knowing that there's something out there they can do, that they're familiar with. They can call the paramedics. And I think that if there was an ambulance not available, it just adds to the anxiety and could cause a heart attack.
Okay, we're going to go to Councillor Pearson.
Question here, and again, I agree 100% with what you're saying, Mayor Davis, about that 10%. I agree with it. Question to the chief, if I could. With the new MPDS system, and somebody calls in and their symptoms are, I've got this, I've got that, do they say, is it part of that system that they would say, hey, you know what, this isn't really, you'd be probably best off to go to a clinic or something like that? Is that part of that system, or would it just be the fact that they're down the list so far that when everything else is looked after, we'll get to you?
Through you, Mr. Chair, you just answered your own question. Correct. They will make that stub toe a lower priority. They cannot refuse service.
Okay.
So if you request an ambulance, they must send one, but you are so far down the queue that it could take minutes if we had vehicles available, or it could take up to hours to get the resources that you require.
Interesting. Okay, thank
So
you.
they, as I said, I would say a 400 set to 2,200 different scenarios of everything else, that's where it would be. Sorry.
Okay, we'll go back to Mayor. It's got to be new information or new.
Yeah, it's kind of a question following up to what the chief has said. So Chief, I mean, right now, we're not running at 110% capacity like we were several years ago. We're running, I think you said, around 89%.
I think it was correct. I don't have the figure in front of
And
me.
that's with 8.5 units.
Correct.
And with this new dispatching system, which is if you got a stub toe, you're probably going to wait hours. And maybe while you're waiting, maybe you'll go to the urgent care or something, because you'll get a lot faster service. Is it reasonable to assume then that, not unreasonable, to leave it at 8.5? I mean, because we have this new dispatch system, which is going to deal, we think, more effectively with that 10% that should not be calling. And we're already running comfortably at about 90%.
Through you, Mr. Chair, I would have to, first of all, look at the stats of other services that have implemented the MPS service to get you an accurate answer. Right now, it would only be an educated guess for our service. Our call volume has also decreased by the use of the CP. So the CP program has really decreased the reoccurring people that was originally added to our call volume. So our 3, 4, 5, 6% that we see going up, CP is having great success of, we call it, the frequent travelers that keep calling us. So our call volume is down with the help of CP, but I'd be glad to look at the figures of other services if MPDS has decreased their call volume.
Right. Last thing I want to say, Mr. Chair, I fully resent members that try and portray what I'm saying in a certain way. In respect to the serious heart attack issue, cardiac arrest, you members know I have been arguing consistently for the last 4 or 5 years that we need to improve our performance and need to respond sooner. The two, what I'm recommending right now is not mutually exclusive. What I'm talking about is trying to deal more effectively with those calls that should not be made. Never would I be in favor of anything that would reduce the response time when it comes to cardiac arrest and serious issues. And I highly resent anyone who would try and portray what it is I'm arguing for in that sense.
Okay, point taken. I just want to, I'm going to call the question, but just I want to work through the mechanics. If we need, well, if it passes, we want to see the budget with 8 ambulances and with 8.5. That will take some time to put together.
Through the chair, there is a tentative meeting scheduled for next week. So, I mean, it will, but we'll have it in time.
Okay, so you will be able, okay, so we can't see that today, but you will be able to get those numbers together for next Wednesday?
We'll
Try.
do our best.
Fair enough. All right. So having, understand that, okay, so, yeah, if the motion's successful, we will have to refer to next week, this recommendation? I'm looking for the correct terminology. What's that? Okay, so we'll have to defer till next week, okay. So just, can you, Mayor Davis, can you just, or did you get it? Okay, so I'm gonna have the clerk read it, if you're okay, and if it's not what you want, then let us know.
So through you, Mr. Chair, what I've captured here is that the staff recommendation be struck and that staff be directed to present a revised budget for consideration based on 8 and 8.5 ambulatory units at the September 17th Paramedic Services Committee meeting.
Yeah, but I'm not suggesting that we're not going to approve at 9. It's just I like to have 3 options, basically.
And I was gonna point that out, I mean, you're not asking to reduce it to 8, but you'd like to see the number.
Yeah, I'd like to see the numbers.
And- Okay, and Councilor Pierce, you second, you're okay with that? Okay, we've had good discussion, good questions. I'm gonna call the vote. All in favor of that motion that's before us? Okay, all opposed? Okay, so that's passed. So that will take us to next week, unfortunately, but that's the way we gotta do things. So we'll move on from that one then to 7.6. And that's the paramedic services budget to actual variance at July 31st. And we're just receiving this as information, but I just want to ask Heather really quickly. I thought is there anything else you wanted to add to that, Heather, before we?
Through you, no, I have
Okay.
nothing to add.
Okay, fair enough. Okay, so can I get a mover then to get that on the floor then, please. That's item 7.6, moved by Councillor Pierce and seconder Mayor Davis. Appreciate it. Any questions, comments? Okay. And based on what we seen last year, we do not take these things lightly. So, and it's, even looking at it this year, it's just something we have to be cognizant of that we could certainly go over. So, okay. All in favor of receiving for information? Opposed? None? Okay. Communications, obviously none, or I shouldn't say obviously, but there are none listed. Other business, we did not have any at the beginning. I'm not going to ask now because we're getting long in the tooth. In camera, nothing. So the next meeting will be September 17th at 11 a.m. here in council chambers. We will have one item before us, and that will be the budget for 2026. So on that note, we will adjourn.